has moved towards an innovating strength-based approach and has taken strides towards these recommendations as a framework for leveraging data to address health inequity within the state. I also want to reemphasize that some of these principles cross over into each other, meaning that one action may address several principles, and I'm going to be categorizing them based on where I believe they fit best. CDPHE has demonstrated the principle of relationship through ongoing partnership with a tribal relations unit in reviewing any interactions or dissemination we have regarding tribal communities. Additionally, through regular meetings with the tribal community representatives, we continue to work on building trust and ensure open two-way communication that prioritizes the community's well-being. CDPHE also upholds the principle of respect by honoring cultural traditions, like adjusting sampling schedules during events such as the bear dance, at the request of tribal partners. Our team cancels couriers and pauses data reporting to accommodate these important celebrations. Additionally, we formalize our respect through memorandums of understanding, ensuring all agreements are reviewed and approved by tribal councils, recognizing and honoring their leadership and sovereignty. The CDPHE Wastewater Surveillance Program also demonstrates the principle of responsibility by using sovereignty-affirming language in our memorandums of understanding, which were created with great attention and effort by the Tribal Relations Unit. In some cases, these agreements are prepared before initial outreach, and this recognizes that historically, we as CDPHE are not starting from a place of shared trust, and that it's our responsibility to help build it. This is also demonstrated in the creation of separate dashboards specifically for tribes, helping keep data private and under the control of these communities. And through monthly meetings to continually work on improving and fostering tribal partnerships through the exchange of information. The team's efforts work towards representation by including the Tribal Relations Unit on Tribal Affairs, where the Tribal Liaison leads initiatives such as partnerships and information dissemination regarding tribal communities. The liaison is supported by tribal health data specialists who are included on calls with tribal communities, ensuring that data updates are shared in a culturally informed and respectful way. And these conversations really help empower tribal leaders and community members to interpret their data and make informed decisions about public health based on their priorities. Our program demonstrates the principle of relevance by offering tribal communities a cost-effective, non-invasive way to monitor public health through wastewater testing. In areas with limited healthcare access and little clinical data, especially with transient populations like casino visitors, this approach really helps detect outbreaks and track health trends that would otherwise go unseen. We also embody reciprocity by ensuring this collaboration is truly mutual. All sampling supplies and courier services are provided at no cost to utilities and communities, including tribes. Additionally, we partner with the Water Environment Federation, or WEF, to provide flow meters and auto samplers to these tribal communities. And the Tribal Relations Unit and the Wastewater Surveillance Coordinator handles the application process for this to secure these resources. Finally, the wastewater surveillance team upholds the principle of tribal self-determination by centering tribal data sovereignty, the right of tribes to control how their data is collected, interpreted, and used. I'll highlight that this authority exists inherently, regardless of state recognition. As mentioned previously, monthly meetings are held with tribal public health nurses. Within these monthly meetings, tribal health data specialists, as well as coordinators and data analysts from the CDPHE wastewater surveillance team, focus on reviewing wastewater data, emphasizing the roles of the tribal partner as data owners and CDPHE as data stewards. This monthly update also allows for transparency and informed consent. Additionally, the existence of a dashboard specifically for tribal data demonstrates data sovereignty by allowing secure data access. CDPHE provides technical support, but the tribe decides how the data is used to protect their community. Our memorandum of understanding precludes us from sharing the data with any external partners and mentioning the tribes we partner with. By ensuring that tribes retain full ownership and control of their wastewater data, we help support informed, self-directed public health decision-making. Tribal communities have long held deep knowledge and innovative solutions to public health challenges, yet generations of systemic injustice have often silenced these voices. At CDPHE, our wastewater surveillance work reflects a commitment to working towards greater health equity. When wastewater-based epidemiology projects are built with tribal communities, they become more culturally relevant, ethically grounded, and ultimately more effective. And this shift requires us to move from leading to listening and from extracting data to building partnerships. So, by continuing to prioritize Indigenous voices, values, and leadership, we can build lasting collaborative frameworks that support public health in ways that are just, equitable, and truly community driven. I'd like to extend a major acknowledgement to the Tribal Relations Unit for all the time, energy, and expertise they've poured into promoting sovereignty affirming practices and building partnerships with tribes and Native communities to improve the health outcomes in Colorado. I'd also like to thank both the Tribal Relations Unit and Wastewater Surveillance team for their support in building this presentation. I'd also like to acknowledge our wastewater surveillance coordinator, Abby Wharton, and wastewater data analyst, Rachel Shaw, for their work in providing data updates and support to our tribal partners, as well as the CDPHE lab team for processing these results. So I'm happy to take any questions at this time, and I appreciate you all for listening.
Thank you, Gabriella. That was an awesome presentation. So if anybody has questions, you can just hop off mute and ask, or if you're more comfortable, you can put it in the chat and then I can ask. Well, I have a question. So I know you gave some first steps on how to start integrating IRM into your work, but could you provide maybe like more specific resources for someone? I'm thinking I'm in research, so if I wanted to include tribes in our research, then how would we start building those relationships? Like, what resources are out there to start forming those bonds before jumping into research projects?
Yeah, so oftentimes communities will have either like a representative or liaison. For example, CDPHE has their own liaison as well as the Tribal Relations Unit. So that's a great start if you have organizations like that. Also, local organizations are huge, like the Denver Indian Health Organization that we have here in Colorado. These local community organizations are also really important in the work, and also have a more established relationship. So, like these community groups and liaisons are going to be, I think, your first, uh, the people you should first approach when talking about this. But I also think that you shouldn't approach these individuals with just teach me everything that I need to know and expect all the work to be on their side. I think that you should approach these conversations with some work already done on your end, like researching the history of the tribe, researching the issues that these tribes have been experiencing. And I think a lot of that is documented. I think a lot of that you'll learn through storytelling as well and sitting down with these communities. So it's a constant learning process. But yeah, definitely those community contacts are really great resources.
Thank you, Gabriella, for that presentation. You all are doing awesome work, and it was good to learn more about it. I'm curious what the reception has been like within the Native communities that you have done community engagement work with. Is it generally positive? And then I guess the related question is, what are some challenges that you have had to work through as a CDPHE team building that relationship with Native communities. What are some things that have come up along the way as you've built those relationships?
And to answer your first question, I think the reception has been generally very positive. Like I mentioned in the presentation, tribal communities are really interested in protecting their community. And especially a resource like wastewater testing for infectious diseases is very accessible to not just tribal communities, but just like general marginalized communities. And so I think the reaction has been more positive, and because these community leaders are involved, vested, and interested in keeping their community safe, and they do an excellent job of doing so. So the tribal contexts that we work with are, from my experience, very engaged, very interested, always asking questions, always looking for the best answer. So that's been my experience with it. And when coming from some challenges, so I'll tell you about a personal challenge of mine is taking this presentation, which was started as a master's thesis. So coming from an academic perspective and then moving towards working for state government, that was for me like, how am I going to approach this now? Like, first of all, academic is a certain perspective, but coming from the government is a completely different ballgame, like a completely different perspective and how to approach this. So um, I think acknowledging where you're coming from, acknowledging that you're not going to know everything, especially coming from academia, especially as a fresh graduate, you're like, I know everything, or like that's how you tend to be when you study for so long. But I think it's really coming from a place of wanting to do the work, and a combination of wanting to do the work and acknowledging that there's so much work to be done. Um, and also acknowledging all the work that already has been done. I think those three things can be challenging, but if you open yourself up to it, it really opens yourself up to a huge world of just a lot of knowledge, a lot of great people. I'm also happy to open the floor to my presenting partners, Gerard and Kim, if they want to talk about some of the challenges that they've experienced. I know that they have a lot of great experience.
Gabriella, I think you're doing great answering these questions. Thank you for presenting, by the way. It's really good information.
Thank you. I appreciate you being here.
Yes, we're very happy to see this information being disseminated in the way it is. So great job, Gabriella.
Thank you. Appreciate it.
What's been one of your favorite aspects of working with Indigenous communities?
For me, it's really been, I'll tell you about the relationship I have with my mentor, which I mentioned in the presentation, Dr. Nancy Lucero, that it is, so I have a very like science background, and my experiences when it comes to like knowledge transfer have been very fast or have been very limited. And coming into my own indigeneity, but also connecting with my mentor has really brought about like an amazing relationship that's continual and that's ever growing. And that through conversation, when it's not just like we hop on a call just to answer these two questions and we hop off. Now we spend time getting to know how we've been, what we're going through, what we think about this, we theorize, it's a whole aspect. And that's when I mentioned earlier the aspect of storytelling, that you need to take the time to understand people's lived experiences, people's needs and desires. And it's not just like, and I think that's can be the problem behind research or just academia or any scientific approach in general, is that you're just coming there to write your notes down and then leave, when it should be an actual process of care and consideration and I think that's really what the process of storytelling is all about, is understanding each other, understanding where you're coming from, and actually caring and listening. And I think obviously that's the thing that you should do, right? From an empathetic standpoint, but it's also just a better data practice and you're going to get better information that way. But that really the point of it is that you should want to do that as you're approaching this community. So that lesson of that, one of the main principles that I mentioned, relationship, that has been really like educational and just informative, and just so whenever I would get off these calls with my mentor, Dr. Nancy Lucero, and any members from the tribal relations unit, I would just feel like warm, just feel good about that conversation. So that's been my favorite part. Thanks for asking that.
That's awesome. Thank you for sharing. We have a couple questions in the chat. Maya asked, she's curious how communities have used the dashboard so far. Any new insights or ability to address problems with a centralized knowledge source?
Yeah. And I'm probably gonna, if Kim, if I missed something, just let me know, because I've only recently started attending these meetings, but they've definitely been, so the people who use this dashboard are particularly public health nurses in these communities. And so it's still at this point with wastewater testing very difficult to establish direct policy on testing, because it's a growing field. But these public health nurses have really used the dashboard to influence what they're gonna, it's not only gonna be like what the response is gonna be, but also preparedness. So where can you, in an area with limited resources, where are you gonna siphon your resources? What area? What supplies do you need? Things like that. So yeah, and I'll let Kim fill in anything I didn't mention.
Great response, Gabriella, because all of that does happen. In terms of public health prevention, they use it to guide their prevention to certain diseases or in certain infections that the tribe, or just in general the area, experiences, which can be related to COVID, which is related to influenza, and they are able to see the data on the trend line, which provides them the ability to act as soon as they see something going on within their community.
Thanks, Kim.
Very cool. Thank you both for sharing. There is another question in the chat from Hannah. She said, can you speak to some of the strategies you used to get started with this work?
Yes. So as I said, I started this as a master's thesis, and honestly, a lot of it was speaking up whenever, like, I'll just talk about some personal strategies, speaking up and advocating for involvement whenever this work, came up, and, really emphasizing, hey, I'm just starting out in this, but I'd really like to be involved in this somehow, any way I can help. And through that, had been really thankfully very connected with my mentor, and from there we just kind of started that like storytelling strategy that I was telling him about. So emphasizing that relationship, and a lot of it honestly has been, I guess it's a aspect of respect in making sure that I am knowledgeable as much as I can when it comes to like existing information. So, Gerard and Kim have been sending me resources, which I've been reading, and they've been amazing. So making sure that you are doing the work as well, like I mentioned. I think it's also just going through the appropriate avenues and being respectful to like who is doing the work, and always acknowledging that. I think it's always important to take the people who, not just the guidance that you're given, but take the people who gave you that guidance with you. I think it's important to like keep them in your presentations, in your general conversations about them, instead of just leaving them behind and never mentioning them again, or because I think you can always go back to these mentors and learn more for each other. So definitely those are like a lot of the strategies that I've used to get started with this work. Yeah, and I'm happy if you have like a follow-up question if I didn't answer that appropriately, but yeah.
That was great. I really like your emphasis on relationship building and storytelling because I feel like that's a big reason why a lot of us go into public health. It's obviously for people. And then when you get into data, it's like we're just focusing on the numbers, but it's good to take a step back and remember why we're doing this work.
Mhm.
We probably have time for 1 or 2 more questions if anyone has them. All right, well, we can end a couple of minutes early. I do have some announcements before I let everybody go. The slides and any additional handouts from this presentation will be available on the Sketch website. You'll all receive a conference evaluation form during our sessions on Friday and via email after the conference is over. So please fill that out, even if you only attended a portion of the conference. It's really helpful for our planning committee. And we will now have a break before the next session begins at 1:45. There are 3 sessions to choose from, so you can view the full schedule on Sketch and choose which one you would like to attend. Thank you all, and thank you so much, Gabriella.
Thanks, Naomi. Thanks, Maya. Appreciate
Yeah.
your help in this.
Just a quick heads up, the recording, which I